Hello, and welcome to Talking General Practice, the podcast from GP Online. I'm Emma Bauer, the editor of GP Online. Coming up on the podcast today, I'm speaking to Dr Helen Thomas, a GP in Hampshire and a member of the group Health Professionals for Safer Screens. Helen's been involved with developing screening tools and training resources to help clinicians identify problematic smartphone use in young people, which might be affecting their mental health. In this conversation, we discuss the growing concern among clinicians and parents about the impact smartphone use has on children and young people's mental health. Helen explains the evidence linking excessive screen time to worsening mental health outcomes, poor sleep and developmental delays, and highlights the harmful content algorithms pushed to young users. She explains why it's vital for GPs to ask about device use when consulting with young people presenting with mental health issues, and outlines the screening tools and resources to help clinicians identify at-risk individuals and support families. Helen is also involved with the Smartphone Free Childhood campaign, and she discusses the wider changes needed to tackle this issue, including what the government should be doing and why we should consider smartphone bans in schools. Just a quick warning that during this conversation we discuss issues including self-harm and suicide. Before we start, just a quick message from our colleagues on MIMS Learning. In-person learning is a vital part of keeping up to date, enabling GPs and other health professionals to learn with colleagues, ask questions of expert speakers and benefit from networking. MIMS Learning's event page gives you details of all the general practice focused learning events, which will provide you with practical take-home points for your practice, along with CPD certification. Visit mimslearning.co.uk/pages/events to find out more. I'm really pleased to welcome onto the podcast now Dr Helen Thomas, who's a GP in Hampshire. She's a member of Healthcare Professionals for Safer Screens and a parent supporter with Smartphone Free Childhood. Thank you for coming on the podcast, Helen.
Hi, morning, Emma. It's really nice to be here. Looking forward to talking about it.
So first of all, before we get into all the details, how is it that you became interested in the impact that smartphones and screen time are having on young people?
Because I am a parent, I think that was the easy start. Now, my children are now 8 and 5, but actually it was probably even a couple of years ago that I started having concerns because I sort of understood that there was going to be a natural progression onto phones at some point, and that made me deeply uncomfortable. I was chatting at a friend's dinner one night and I said, I think my girls just won't have them. And another mum sort of turned around and went, yeah, good luck with that. And I thought, gosh, well, therein lies the problem. It's just really tough. It's completely everywhere. And then about 4 months after that, Smartphone Free Childhood burst onto the scene. And I thought, oh, that's great, because I'm not the only mum out there. And they have done just amazing things at catalysing the movement. But as I got more involved with them, I was hearing things like mental health and eating disorders and sleep disorders. And I thought, that's a healthcare voice there. Where is that healthcare voice? So I went hunting and I found Health Professionals for Safer Screens and the absolutely amazing Rebecca and Arabella who head that. And I had a meeting with them and just said, look, what can I do? And the upshot from that is that we need to try and get the message out there. And as we tried to get the message out there, we quite quickly realised that no one really knew anything about it. So then we slightly U-turned and said, okay, so we still want to get the message out there, but actually we need to provide some training. And then that's how that project started.
What does the evidence say about the impact of smartphones on young people's mental health? Do we actually really understand what's going on with this?
Well, there's one very clear answer, is that there's loads more research now coming out, and that research all says that the children that are on their phones longer than they should be clearly have worse mental health outcomes. They clearly have their sleep impacted, and they clearly have worse school grades. The difficulty in the argument is that a lot of people, particularly around creating policy and catalysing actual change, they say that those studies aren't the right type of studies, or they're not the good enough studies. So then we're getting into really tricky situations. The second part of that is the evidence. We've got amazing amounts of lived evidence. So you have got hundreds of healthcare professionals, of teachers and of parents going, absolutely, there's a problem. And the two or the three, I suppose, aren't quite marrying up. We've got the lived experience that is saying there's absolutely a problem. We've got the research that says, yeah, we agree, there's a problem. But then you've got vast amounts of people who are saying, nah, there's not really a problem. So that's a very difficult kind of position that lots of us are finding ourselves in.
So when we talk about problematic screen use, what exactly do we mean? Is it about the amount of time young people are spending on screens, or is it about what they're seeing when they're on there, or is it both of those things?
It's both and it's more. So problematic smartphone use isn't necessarily a defined amount of time. But what we do know is that once you get over a defined amount of time, and that's around 2 to 4 hours, those problems start escalating. So if you are having less time, you are less likely, but not impossible to be impacted. But the longer you're on your device every day, the increasing risk of harm is very evident. And clearly, you can be on your phone for half an hour and see appalling content, but you're also very likely to be fed more and more dangerous and harmful content by social media algorithms if you are on your device for longer. And in terms of the content that we really worry about, it's looking at the harmful content that the algorithms, for, in particular on TikTok, that push our children. And we know from some studies that were done that within 8 minutes, young girls are often pushed content on eating disorders and self-harm, and young men often get quite violent content. And the second that you engage with any of those videos, that then escalates the amount that you're pushed. And also, really importantly, as adults, I don't think that we really understand what our kids are getting pushed. And I think that's very clear from when I do the training and some of the stats and the examples that I give. A room full of GPs or a room full of pediatricians and health professionals goes silent. And I think, as an example, Emma, the Children's Commissioner last year now asked a group of children how many had seen a beheading video. And 75% of our 15-year-olds have been sent and seen one. And when I then present that to a room full of healthcare professionals or adults, it's absolute silence because no adult's ever seen that. How's that going round? So that sort of content, and again, kind of the suicide content. As adults, we have very curated algorithms, and actually the algorithms aren't really interested in us as adults. So the content that our kids are seeing is vastly different, and I think that's really important to be aware of.
Yeah, it's actually really interesting. Those studies you mentioned, I actually watched a video. I just saw it on The Guardian yesterday, and it's really interesting. I might put a link to it in this because basically the reporter on that, they basically set up 2 accounts for teenage boy and teenage girl to try and replicate those studies you were talking about. And that you can see the content that the boys and the girls get shown within, like you say, less than 10 minutes of being on TikTok. Kind of knew that boys saw a lot of that stuff, but I was quite surprised by how much it was. But the stuff the girls were seeing about body image and dieting and things that you would see as a 13-year-old, I found quite disturbing in particular as well.
And the stats go hand in hand with that because we've got rising rates of young girls with eating disorder type symptoms and body dysmorphias, and they're escalating, and the girls are getting younger.
Yeah, it's really frightening. Problematic smartphone use is a problem for society more widely. Adults, there's probably people listening to this who know that they spend way too much time on their phone, me as well. Why should we be particularly concerned about this for young people? Because obviously one of the things that might be quite difficult for people to understand is why is it a problem for their kids, for example, if, as an adult, they're on their phone all the time anyway, it's just kind of normalised.
So firstly, I would say as adults, we need to readdress the way that we use our smartphones because one of the key things that comes up time and time again about how we can support our children in reducing their use is to model good behaviours and to model good habits. And actually, when we are stuck to our phones, we lose sight of that connection that we're supposed to have with our children. We lose sight of what we should have been doing in that moment, often with our families and with our children. But particularly coming back to what you're saying, so about young people, it's about development. So another shocking statistic is that about 25% of 3 to 4-year-olds now have their own named device. So that's a device, often a hand-me-down, often a tablet or an iPad, but they have that device and that is theirs. And what you're finding is there's an awful lot of education type videos or games that are being pushed to us as parents to say that this is really beneficial. So actually we start getting these messages that actually give your child this tablet, give your child this device, and actually, yes, that they can sit and they can learn on it. But actually, a lot of the studies are showing that kids do not learn from devices. Kids learn from lived experience and they learn from other people. So what we're seeing is we've got lots of children in early years setting that have significantly delayed development compared to 5 and 10 years ago. We have children with considerably less learnt words and vocabulary. There's very good research that says for every amount of extra time, so I think it's an hour that a child is on a device, they lose set amount of words because they don't hear them. We had some reports, I think were out last year, that were saying that children were attending school, they didn't know how to turn the page of a book, they were trying to swipe it. And the other big thing is about behavior and behavior regulation. And what you see is this digital dummy effect. So child really likes to watch their favorite cartoons or some very interactive videos that are sort of cartoony and music based. That gets taken away. The child absolutely loses it. And often you'll see in situations where there's bad behavior, an adult will very quickly give that and the child will calm down instantly. That's not because they're learning to emotionally regulate, it's because they've just switched off and they've become distracted. And what we're seeing is that children that are using devices or being given devices to use for digital dummies have real difficulties with their emotional regulation. So we've got children with significant speech and language delay, we've got children with significant behavioural challenges, and we've got families that have lost that connection. And that's absolutely vital for our early years and setting kids up for the rest of their life. So that's why that's super important. But then I think, again, as children are getting older and into the secondary schools, actually, when they're on their devices for a long time, and we know that there's risk there of mental health issues, depression, anxiety, poor sleep, bullying, seeing harmful content, having the trauma associated with that, actually, it's our role as parents, it's our role as clinicians and safeguarders to recognize that that is not a healthy thing. So actually taking away this device, and I often quite like to reframe it as it's a harmful device that delivers a harmful substance. You know, in the same way the cigarette delivers the nicotine or the bottle delivers the alcohol, the smartphone is delivering harmful content. And in the same way that all parents want the best and want to protect their children, and as healthcare professionals, we want to support parents having healthy children, we need to look at reframing and rebranding the device as harmful.
As a GP, you said you've been involved in training other clinicians about all of this.
Yeah.
Why is it important that GPs understand this, and what should they kind of be aware about in day-to-day clinical practice when they're seeing young people?
So we have got a mental health crisis, higher than ever rates of referrals to CAM, so the Children and Adolescent Mental Health Services. There was a study released last year that said our referrals into acute hospitals for acute mental health are up 65%, and that's compared to 10% for all other causes across childhood. So we know that there's a mental health crisis. We know that our services are completely overwhelmed, and we know that our young people are struggling, that our young people are not then being able to live the lives that they want and grow up into adulthood and then function as they want and as society needs. So as GPs, we're often the front door. And so actually, if we're hearing from parents that there's a teenager or a young person that has behavior change, mood change, they're not sleeping, they're more anxious, they've started self-harming, they've got headaches, their school grades are dropping, it's a very wide range. Actually, we need to say, do you know what? There could be a very easy intervention here. And I think that's the key. This is not rocket science. If we could say, and we do this with all of our public health screening, if we can say we can easily identify something that we could act on, and then we could reverse or we could improve, and then we will see better health, we have to be able to do that. And the whole point here was that I wanted to make this as easy as possible. And so that's how the training and the screening tools came about.
So what exactly are the screening tools? How do they work?
The health professionals team spent quite a while looking at all the ones that were available, because there's no point reinventing the wheel, because actually screening tools need to be validated and they need to be well used and evidence-based. So we went through some of the ones that already existed, and there are lots of ones out there, particularly looking at device use and gaming use and mental health. And actually there was one that was used by a study group, Kwon et al., and that particularly looked at device use and combined that with sort of addictive psychology. So the screening tool, very sexily, is called SASSV. SV stands for the short version, and it's a 10-point question that is ranked from 1 to 6 based on how strongly you agree with something. So there's a comment, for example, I could never live without my smartphone, and you either strongly disagree with that or on a range of answers, you strongly agree with that. And if over the course of answering those questions, it looks like you have significant psychological dependence on your smartphone, then you will score quite highly. There's a threshold. In the research, they use two thresholds, one for boys, one for girls. Again, we wanted to make this as easy as possible, so we used a lower threshold and just used that for all that take part. If you cross that threshold, that identifies you as a problematic smartphone user. Again, not just about the length of time, but about the psychology and the behavior change that you demonstrate towards your device. And at that point, what we then would like clinicians to be doing is to say, okay, actually, I've got someone at risk now. How can I support that person? What resources can I share? Where could I signpost people to? Because everyone in healthcare is busy. And the last thing I want to be doing is saying to my colleagues as GPs, I found a new way that you can have to spend more time trying to sort everyone else out. What we need to do is say, okay, I think this could be a problem. In my brain, I know that I can start asking these questions because we've developed a nice, easy flow chart how to have these conversations. I've had the conversation. I think there might be an issue. I've got a text message lined up with a link to a screening tool. I can send that one off. That comes back, or I can do it with the person in the clinic room, just like we do our PHQ-9s and our GAD scores. There's a problem. This is what I need to do because it's all nice lined out for me. Here's the resources. Here's the website I can send them to. And if, as a GP practice or your PCN has got health and wellbeing providers or youth counsellors, we're trying to reach out. I've been trying to do some work with them as well to say, this is a thing. Here are some resources. So again, we're not trying to add to people's workload. We just want awareness because actually, and I've just started an audit in my practice to identify these potential patients. If we give you some intervention, if we signpost you to the right places, if we give you some resources, can we make changes and then do those changes help your mental health and wellbeing?
And is that what Health Professionals for Safer Screens does? This is where the resources are? I was just going to ask a bit more about what that group does.
So Health Professionals for Safer Screens is a fantastic team of multidisciplinary team members. So we've got GPs, paediatricians, psychologists, speech and language therapists, counsellors, and many, many more. But what we are particularly looking at is not just about what the evidence is out there, but what do we find in our practice that's happening and how would we like to solve that problem? So, for example, over the summer, there were two fantastic new resources released. One was, why is everyone talking about kids and smartphones? And then the other one was, screens and kids, what's all the fuss? And they were very straightforward, sort of 2-page leaflets that explain in very simple language what the problem is and why we should be doing something about it and what that something is. And they are so user-friendly. So there's those, but then there's also things about early years and how to thrive and posters that talk about, based on your age range, this is how much sleep you should be getting, this is how much activity you should be getting, and this is how much screen time you should or shouldn't be getting, and how you can, as a parent, then do other things or think about screens in a different way. So the health professionals are really good at working very proactively. So what do we think we need as clinicians? What do we think we need as parents? Trying to then engage legislation and politically as well, looking at, look, this is the evidence. So particularly Arabella, who brings together a lot of the research, really makes sure it's very fact-checked and substantial, good quality evidence, and then brings that to us all to say, what do we do with that? And is often putting documents together to help support us as clinicians, but also to support MPs and legislative change as well. So they've got lots of things going on, but the main aim there is we are an evidence-based hub that parents and clinicians can come to. You can find resources, you can find support, you can ask us questions, we can provide you training, we can point you in the right direction.
What do you think needs to happen on a national level? Because I've mentioned at the start as well, you're also involved with Smartphone-Free Childhood, which is a wider kind of campaigning group about this issue, isn't it? So what would you like to see the government do?
I mean, in an ideal world, they would step forward and they would say, yes, we will ban smartphones in schools. And by ban, that needs to be a proper restrictive policy. It's not just turn your phone off and stick it in the bag till the end of the day, because we know those don't work. It needs to be you either do not bring a phone onto the premises or you have secure storage so that that phone is off the child for the whole course of the school day. In an ideal world, that would be what happens. Now, lots of private schools have already made that decision themselves and have great outcomes and great evidence. Some of the state and government funded schools are also doing that. But there are barriers. There's barriers about the logistics and there's barriers about the cost. So if government stepped up and said blanketly, yes, this needs to happen, I think that would be very supportive for a lot of schools. Legislative change and policy change from much higher. So having the smartphone bans for 16 and under, having proper age checks across all the social media sites and proper penalties for when those aren't adhered to would also be fantastic. But it seems very murky. And I think a lot of us working as health professionals in this field see that huge body of evidence, and we see the risk and the potential risk. And what is very difficult is we can't understand why the government don't want to act. We've got lots of evidence that occasionally they argue isn't good enough, but it's there. And then we have this huge experience of lived experience of teachers and of parents and of health professionals saying, we're really worried, we're absolutely seeing this. And I think the kind of the dragging of the heels as to no one wanting to make decisions and actually just asking for, we'll have a look at this when we've got some more robust evidence, that could take 5 years. And I think we're currently looking into the kind of abyss of child mental health and why it should get even worse and risk the health and well-being of our children before some changes are made, I find very difficult. There are some fantastic things that are happening now. Esther Gray, who tragically lost her daughter, and that's been her catalyst. She's got a campaign coming out, and I've just started seeing that going around online. Absolutely fantastic, really calling for proper change and proper banning of schools, proper restrictive policies, asking for secure storage for schools to either separate the phone from the child or not have that. So she's fantastic and has been working with the health professionals team to sort of support each other and to see what help we can provide with the evidence base. The other thing is Royal College support, because if the Royal Colleges could come out and say, we see this body of harm, we hear what our clinicians are telling us. So the Royal College of General Practitioners, the Royal College of Child and Adolescent Health, the Royal College of Psychiatrists, there's murmurings, there are changes, but we haven't had big, bold statements. Colleges historically have been fantastically, proactive. You see a potential health issue and we've acted on that. And again, it feels like the colleges just aren't quite there and they're not quite sure. And definitely as health professionals for Safer Screens, we'd love to be doing more. We'd love to be talking through the evidence. We'd love to be delivering training to help that. But for those colleges to sort of come out with a supportive statement about, actually, yeah, we recognise there's a potential risk and a real life lived risk, and we would suggest that actually we need to be more aware of it in supporting bans, all those sorts of things, that would be fantastically helpful.
We've talked a little bit about the fact that there's a rise in mental health issues among children and young people, and we know that CAMS are struggling to cope with it. Do mental health services have the resources and the sort of training they need to deal with? If a GP does identify someone that's got problematic smartphone use, is very unhappy, is there enough understanding and enough support for people to get help?
No, absolutely not. I think we have to be fair here as well. This is still quite a novel concept. So when I started working with health professionals for Safer Screens, it was October, November last year. And we finally completed and distributed the training. We launched in April. So because I'm in Hampshire, I focused on our ICB and the secondary care trusts that go with that. So Hampshire and Isle of Wight ICB. And within that, we've got Queen Alexandra, so the main hospital in Portsmouth. We've got University Hospital in Southampton, Winchester, Basingstoke, Salisbury sort of sits a little bit on the edge, and those paediatric departments, and then those CAMS departments that go. And what I quite quickly recognised as I was trying to make this project work is that in healthcare, you think NHS and you sort of think one big institution and we're all connected. And the reality is we are so disparate. So actually, you think, okay, well, I've got all the GPs, great. And I've got all the paediatricians. That was quite straightforward to identify everyone. CAMS are completely different. They're funded and they're sourced differently. So they don't sit amongst a trust as such. And then you think, okay, well, who else is involved? Okay, so public health. Well, they sit under the county council. Where do the safeguarding teams fit? Well, they're under county council, but they're in a slightly different team. Where does education sit for the teachers? That's a different team again. So the more you try and involve and then try and pull people together, it is a bit of a logistical nightmare. So I've been delivering regional training days for GPs. We call them Target in Hampshire. And so I've been doing those now on and off for about 6 months. brilliantly, I've been given workshop slots as well. So I do a bit of a lecture at the beginning, but then we've got an extra session to really go through those tools and to get GPs really engaged with them, to understand how you could use them, to understand how they will help your consultation, not add to it. And I've done some training with CAMS, but it's trying to bring the groups together in such a way that you could deliver that training in one hit, and you could almost make a pathway and get a standardized pathway out in one hit, to then kind of get at least Hampshire all on the same page to say, these are your resources, this is what you should be doing, this is, all of that. And I think that would be really helpful. And I haven't quite figured out how to do that one yet.
Do GPs deal with more consultations with parents as well who are potentially worried about their child's smartphone use? Is that something that comes up? And then what can GPs do if that's the case?
Really good question. So I would say I've had a few. I also do parent and school talks. Sometimes that's because where I work in my area, if I've then done a school talk and a parent might come in to see me for a completely different reason, they're like, "Oh, you did that talk at our school the other day. Oh, I'm really worried about." Sometimes that's come up a couple of times. I have had a call where the parent, and if your child is under 15 or 16, I think that's really normal that actually as the parent you're doing the call, you're doing the booking in at least, and says, "I really need to talk to you about my son's mental health," or I've had a really sad one. Mum rang up and she said my daughter started cutting herself. And actually, when they came in, what transpired was actually there was a huge role in social media, sadly, not unexpectedly, but very sadly. What I think is a really important question is, if kids are on their phones for a really long time, there are arguments that lots of them get really positive connections, and particularly for minority groups, so people that might feel otherwise isolated or ostracized, they can find their tribe on social media. When we're talking to teens and young people, I think as adults sometimes we can be accused of not understanding why they need it. But actually what I think is really relevant is to always ask, when you finish scrolling for however many hours it was, how do you feel? Now, I've had some consultations where teens have said to me, "Oh, I'll do 2 or 3 hours." But they'll feel, "Oh, I felt really positive." Often it's the more arty teens, or my experience with at least the 2 or 3 that I was talking to. It's like, actually, no, I found some really good inspiration. I've got this project. I was looking for something, so I felt really positive, and that's great. But if the answer is no, I didn't feel so good, and for this girl's situation, she said, no, actually, I'd watched loads and I just felt so bad about myself. I wasn't living up to standards. I wasn't looking a certain way. I wasn't doing all these things. And she said some of the stuff that had come up was about self-harm. And so she said, well, that's when I started cutting myself.
God, it's awful, isn't it?
In the one positive way, that was such a clear, A to B link, that actually, we were able to talk and to offer some support and find out different strategies. And that didn't happen again. So that's good.
From your experience, are there any sort of common misconceptions parents or young people have about smartphone use and mental well-being? Are people becoming more aware of the fact that there is a connection between lots of phone use and poor mental health, or do people just still think it's not connected?
I think you probably have two camps. I think you have the parents that come to my talks, or the parents that are really engaged with the smartphone free childhood movement. And those are the parents that are already making the changes. And fantastically for them, they are the parents that are reaping the benefits. Because if you talk to a lot of them, you will hear the same sorts of stories. You will hear the battles that they had about screen time. You will hear about the poor sleep. You will hear about the strained family relations. And then devices are then really limited, either coming out just for an hour in an evening or not at all in the weekday. And then they have some supervised time at the weekend. We're absolutely hearing positive stories and positive change. In the other camp, though, we do have oh, but it's not my child. And that's fine, because again, some children are not using their devices dangerously, badly, or in a negatively impactful way. So I think it's just trying to be mindful of, if there are problems, think about it.
What can we do to sort of empower young people themselves to understand how to use their phones safely? Because obviously that's the key to it, isn't it, really, is to make young people themselves aware that spending too much time on their phone is probably not a great thing for anybody.
And I think there's a real risk there of just being the fuddy-duddy grown-up, isn't there? Oh, you don't understand. We've all got it, And I think that's valid. So I think we really need to be listening to our young people to say, what can we do? But I think hand in hand with that has to come the parental responsible role that we all do anyway. We wouldn't drive without letting our kids put their seatbelt on. So actually, again, reframing this as a harmful device. I hear you want to use your phone. Let's talk about it, because actually I know that if you're on it too long, you're likely to not feel great about yourself. If you're on it too long, you might see some harmful content. So education is really key. Modeling good behaviors as a parent is really key, and using age appropriate devices is really key. So as parents, we need to normalize that we're not on our phones all the time, that we recognize that there's a time and a place for them and the impact that it might have. And some of the early years information that health professionals did was things like, if you do have to be on your phone, explain it to your child, particularly the preschoolers. Oh, mummy doesn't quite know where she's going. I'm getting my map out. And then you put the phone away. And that's shown to be really, really helpful. The other thing is recognizing that kids need their friends. They need to go and play. They need to communicate. They need to have their own freedoms as well. And Jonathan Haidt and the Let Grow movement are fantastic about supporting parents to, release your children a little bit more safely and real life risk. So actually arranging play dates so that kids can go and play outside, particularly. Recognizing that, if a child doesn't have a device, they might feel literally disconnected, and how are they going to find out about what's going on? So parents need to come together, and that's what Smartphone Free Childhood is very good about, getting parents together to make those packs so that you have little pockets of friends who aren't on devices, and then they are feeling less and less left out.
How do you see the landscape evolving in terms of smartphone use and its impact on young people's mental health in the next sort of 5 to 10 years, both in terms of the impact smartphone use is going to have and perhaps, how greater awareness about the impact might change things for the positive?
I hope that what is going to happen is that we have more awareness, and that actually with that awareness some safeguards start coming in, so that we see a normalization of devices not being accessible to kids before ideally 16, and a move away from that. I hope that there will be some legislative change. I hope that there will be emerging medical evidence that is acceptable so that we can push forwards those change. That should give us a healthier cohort of young people. What I worry about is that, in the last couple of years, as much evidence has been forthcoming, there is consistent pushback and denial. And sometimes it feels like we're not going to be able to get past that. What I also worry about is that in so many fields, the digitalization and the use of AI is just ramping up, and it's getting more and more and more. And I don't know how those two can go hand in hand, because I think we've got to be realistic. Our kids are growing up in a digital world. And I think one of the most important skills is about fact checking and discernment about what is being seen and what is safe use. Schools and parents have a real role as educators to say, you need to know how to use this to be a 2026, 27, 28, 2030 child or teen. But you also know how to use it safely, and you need to know what is too much. You need to be, I think, in a way, even more aware of your emotions and your feelings. Actually, that made me feel uncomfortable. Okay, what do I do about it? That's nonsense. I don't believe that that's a real news story. That's not a real picture. Okay, well, how do you go about fact checking, and what do you do if it's absolute rubbish? I worry that our kids and us as adults are going to get more and more bombarded with things like AI and fake pictures and fake news, and everything is being digitalized. And yes, there are positives for that in terms of workflow efficiency, particularly in healthcare. But I think we need to discern where that fits in our real lived lives.
As a journalist, that's one of the things I've taught my kids from the word go about using the internet, is you need to understand that there is probably an agenda behind a lot of the stuff you see. You need to understand where it's coming from, and the whole thing about fake news. And I don't think enough is done to teach kids about critical thinking and about understanding where their information is coming from. The tech companies, what's their role in all of this? I mean, this is kind of well outside of healthcare now, but what do you think they need to be doing? I mean, obviously there should be stricter rules and they should be better at clamping down on fake information, but is there anything else they could be doing?
This has to come with a caveat that this is probably a lot of personal views here. Talking about agendas, I think their agendas are polar opposite of healthcare professionals. agendas, and their agendas are about continuing to make money. But that's why they exist. In a way, that's fine, and that is a fact. So their agendas are never going to align, and unless the penalties for not aligning become, proper, there's no incentive for them to change. There's no incentive for them to be actually checking, because actually, again, all needs to be always fact checked, but leaked documents from Apple or Google say that actually teenagers in the 13 to 15 are our biggest consumers, and we need to work out how to target them more. Tech companies are very aware that our teens are very impressionable. I don't think they recognize how vulnerable they are, but their agenda is to get as much information out as possible. So they will not be aligning, I don't think, with age checks and clamping down on things unless there are some absolute proper penalties for them. And for whatever reason, I don't think the government seems to be particularly keen on driving that too hard. I don't know if there's it's a political, business, financial, global agenda, but the two are not aligning.
What's the one key takeaway message you would want, like GPs or other healthcare professionals who are listening to this? What's the one message you'd like them to gain from this conversation?
So I think if you think that there is a mental health issue, I think always ask about smartphone and device use, and know that there are tools and resources out there to support you, and know how to access them. Hearing this, GPs could go to the Health Professionals for Safer Screen website. They could watch the training module, because that's there to download, to use it within their practices, to download the flow charts and the screening tools and the resources, and ask the questions, use the resources, and support our kids, hopefully have better mental health outcomes.
Yeah, well, we can put a link to all of those resources in the notes for this episode. But that's brilliant, Helen. Thank you so much for your time today. Thanks for speaking to me. It's been really good talking to you.
I've really enjoyed it. Thank you, Emma.
Well, that's it for this week. Thanks for listening, and thanks again to Helen for speaking with me. I'll be back next week for our regular news review, so please do join me then. In the meantime, don't forget you can keep up to date with all the latest news affecting primary care and access lots of other resources on our website at GPonline.com.